back to Great Day Houston. More than 37 million Americans suffer from sinusitis every year, making it one of the most common health issues in the U.S. While most treatments focus on relieving the symptoms, they don't address the root cause. Here to help you breathe easy, welcome back Dr. Michael Kaplan of Kaplan Sinus Relief, along with his patient, Sylvia Aptekar. Good morning.
Good morning.
All right, so for a lot of people, they may have these issues of like the headaches and the stuffiness and the whole bit, and they think, oh, it's just allergies, and they take over-the-counter medications. What can be an issue with that?
The medications work a large part of the time, but not always. For those patients for which the medicines don't work, you're talking about symptoms such as chronic headaches, congestion, pressure, patients who are on multiple courses of antibiotics throughout the year.
Yeah, and using the antibiotics over and over again, that can be a problem too.
That's right. You develop resistant infections, not to mention the cost of this medical treatment.
Yeah. All right. So Sylvia, when we talk about headaches and stuffiness and the whole bit, we're talking about downright debilitating. What was everyday life like for you?
Well, constant headaches. I lived with sinus infections on a regular basis and found myself needing all kinds of medication. And after a while, you're dizzy, you can't function the way you should be functioning.
Yeah, and so she's the perfect candidate. If you're somebody at home who keeps having them recurring,
absolutely,
perfect patient for the balloon sinuplasty treatment that you do.
Correct.
So what is, first of all, happening with somebody who might need a procedure like this? We were talking about, it's kind of like a plumbing problem in the face, right?
Well, imagine you have an hourglass.
Yeah.
Kind of like an hourglass. You got the sinus here, you got a narrow channel that drains down into the nose. In Sylvia's situation, the channels were blocked. So I go in with a little tiny balloon device and I open up that channel
so
to
when
get
it's
better
blocked,
drainage.
You're stuffed up, right?
Right.
And then also it's a perfect atmosphere for infections to occur.
Correct. So by obtaining better drainage, I can resolve these recurring infections and chronic headaches. It's done in the office, takes about 20 minutes. I can keep you relaxed with either some medicine by mouth or we put a little IV in the hand, you fall asleep, either one.
Yeah.
And within a week, generally you're breathing better. Within 2 weeks, you're breathing better than you have in years consistently.
Yeah.
And
literally what you did was went in and opened things up?
Yeah. I just went in and opened things up and you stuff it for a few days, but really, generally, about 90% of the time, the patients are overwhelmingly happy.
Yeah, now things can flow, right?
Absolutely.
And those infections can stop.
And you can think clearly.
And you can think clearly. All right.
Which is helpful.
So take us through the process when you went through it, and you're about, what, 3 weeks out now?
Just about, maybe closer to a month.
Okay.
Came into the office. I took oral medication, not wanting IV. I remember nothing from the procedure other than my girlfriend showing me the way into the apartment.
Yeah,
that was it. That was it.
You're home
After
now.
that,
Yeah.
I'm home. It was hardly any pain at all. Honestly, I think I was on Tylenol for anything. And within 24 hours, I could breathe. I was comfortable. It was like nothing ever happened. It really wasn't painful.
And you haven't had any headaches?
None at all. None at all. It's very simple and easy to do.
Yeah, because you were functioning this way for how long?
Oh, too many years.
Yeah.
Yeah, over 10 years for sure.
So it's almost got to be a surprise. You wake up in the morning and go, oh, wait, I can breathe and there's no headache.
It usually didn't happen like that. It usually happened during, you get your day started and then you're ready to get out the door and you go, oh, wait.
Yeah, it's like I don't have any headaches anymore. Okay, who's the person who should consider something like this?
Patients with chronic headaches, recurring headaches, pressure, congestion, drainage, you're on multiple antibiotics, you're not responding to treatment. Those are exactly the kind of
All right,
patients.
and the good thing about this is it's covered by insurance.
It's covered overwhelmingly by the vast majority of carriers and fully covered by Medicare.
Yeah, all right. What are some of the other things at Kaplan Sinus Relief? What are some of the other things that you cover in the office? We mentioned allergies earlier.
Sure, we do allergy testing. I have my own CAT scan machine in the office. I can target your snoring, sleep apnea, and any underlying other respiratory issues.
Yeah, and I remember years ago you handled my ear problem.
I did.
Right. All right, thank you very much. For information and to book an appointment with Dr. Michael Kaplan of Kaplan Sinus Relief, you can call this number, 713-903-2557, 713-903-2557, or visit kaplansinusrelief.com.